Good afternoon, everybody. I just wanted to give you a short video of my experience with a hysteroscopy at my doctor's office yesterday for some investigation of some postmenopausal uterine bleeding. I've had a normal transvaginal ultrasound, but I've had a couple episodes of bleeding, so my doctor decided that she wanted to do some investigating further and a possible biopsy. But I wanted to post a video to let you know of my experience so that people can be their own advocates and know exactly what the pain is like for this. When I called to ask about an explanation of the procedure, the medical assistant I talked to was not the doctor's normal medical assistant, but a fill-in. And I was told that, oh, it's not, not a piece of cake. It's not a cakewalk, but you'll be fine. If you've had children before, you'll know what it's like. And all her patients that she's ever done have walked out on their own, that it's really not a big issue, and it's fine. I asked, well, should I take some ibuprofen beforehand? And she was kind of like, well, I guess if you want. So I was like, oh, okay, put at ease, thinking, oh, it won't be so bad. So I did go ahead and take 800 ibuprofen about an hour before the procedure. Also took a little bit of an anti-anxiety medicine because I was so nervous about the procedure. When I got there, they took my vital signs, and then it was just in the regular exam room. And the first thing they did was put the speculum in like they do for a normal pelvic exam. And then she proceeded to numb my cervix. That hurt like a dental shot, when it's kind of that sting and then it goes away. There was one area that hurt more than another area, but it was very short. That was tolerable. That wasn't a problem. Then she waited just a few minutes till that numbed up, and then she proceeded to put the long-tubed camera into through my cervix and into my uterus. At that point, she filled it up with water because she had to extend it. Since I'm postmenopausal, my uterus has collapsed already. And she looked at it, and when she put in that water, then there was some cramping, tolerable cramping, probably like the worst period cramps I've ever had, but I'm like, okay, this is okay, we can do this. Then she was looking around, very quickly, trying to get things done quick, and said things look really good. She started to back out and goes, oh, there's one little area of thickening there. I do want to take a sample of that. And that's when things got excruciatingly painful. So painful, I was crying. I was squeezing my husband's hands so hard that I thought I was going to break his hand. I'm still traumatized by it. I could cry about it right now. And then I asked her, how much longer is this going to go on? And she said, about a minute. I thought, okay, I'm just going to close my eyes and breathe and try to get through this. And then she then went down into the cervical canal, now that I know, and then she did scraping, cutterage, I guess they call it cutterage, and biopsy of the whole cervical canal. And that was horrifyingly, excruciatingly painful, worse than up in the uterus. And again, all I could do was lay there. My entire body was tense. And I know that because later on when I got home that afternoon yesterday, all of my muscles were sore. And it's from them just being clenched and tightened and isotonically as I was laying there trying to just get through the pain. And I was just trying to breathe through the pain. And finally, she was done. And when she pulled everything out, she very gently took my feet out of the stirrups and put my knees up on the table. And it took everything I had just to lay there and breathe. And she, said, commended me on doing a good job, and, said, take as much time as you need to just, before you need to go. And she showed me a few pictures on the monitor of what she found and how she really feels like things are very good, that it'll come back, the biopsies should come back fine. And then she went ahead and left the room, and it was just my husband and I proceeded to cry because it was so painful. Most of the excruciating pain was gone at that point, but it had been so painful that I had to, kind of release the emotion at that point. I probably laid on the table for about another 5-10 minutes because when she numbed the cervix, she put shots of lidocaine in there, and it kind of affected my entire body, made me feel a little woozy, made my ears feel stuffy. So when I felt like I could, I sat up on the edge. I wasn't dizzy like I feared I would be, and then I got up and got dressed, and I wasn't dizzy or anything. It was painful to walk to the car. I was still having cramps. There was a little bit of bleeding. Then the rest of that day, I did have really bad cramping now and again. 800 ibuprofen would take care of it. I am also on a prophylactic antibiotic, which I was very thankful for. I think that is very professional of them. I love my doctor. I think she's wonderful. But I'm posting this video so that people that are going in for their first hysteroscopy can possibly think about asking their doctor to do it in an outpatient setting, or ask their doctor for some medication beforehand to help alleviate the pain, because that pain nobody should have to endure. It was barbaric, horrific, archaic medical practice for our days today. So my procedure was over 24 hours ago now. It was probably about 30 hours ago now, and I don't have any more cramps, hardly any bleeding, which is nice. I still feel kind of tired today. Part of that is the antibiotics, and I've just kind of been taking it easy. I haven't been, staying in bed, but I'm not doing anything major. I get up, walk around, do a few chores, not lifting anything heavy or anything like that. So please just be your own advocate for your health, and make sure that you truly ask the questions of the pain factors, because I could tell when I left the way the nurse was looking at me and the way she told me that she could not believe how strong of a woman I was to make it through that was a super, super painful procedure. So good luck to you all, and let's remember that our bodies are ours and that we have the right to ask for things to help us make it through procedures.